Hello, this is for you as a parent and your kids. Maybe they will not understand why it's important now, but trust me, as we grow, don't you love this? Put in this. As we grow, then we realize I was blessed by these parents that knew about dental care. I grew at the time that, it was not really a lot of education. And if it was, your parents have to be very tough. And they work with me. And it works, but also in every sense. My mom was tough with nutrition, with brushing your teeth also, flossing. The man never understood, right, the brothers. But it's important that, when do I take my child to the doctor? Well, nowadays, thanks to the new development in the United States, which is called CAMBRA, where Dr. Francisco Ramos Gomez and Dr. Featherstone were extremely developing these steps that you have to use in CAMBRA, which means caries assessment and risk factors for the kids. How do you manage the risk factors, right? So when you have a child and you said, what do I do? Sometimes they said, I don't have the money, I don't have insurance. But I have a best example about, I'm in Beverly Hills, in the prime area, and a friend of my nephew, like my son, brings me his kid. And his kid, this guy has now, lately these years, the money to afford a dentist. Now he doesn't trust, the daughter's been traumatized, and she's 4 years old. And he says, what I'm gonna do with my kid, it's full of decay. I want to know if it's true. And I know you're not a pediatric dentist, but I trust you. I need you to see my daughter. And then he says, my daughter was like this in the 2021. I don't know, it was around almost 4. And look what happened. She has these caries, just a little bit. This is the coronal part, so you have to learn for your kids when you go to the dentist. When you see this black area, could mean it's the beginning of caries. Remember I talked to you about this is a little caries that you will see here? Well, when you look at the camera right here, you will see that it haven't get to the dentin. Just exactly like you see in this image, still is not almost close to the dentin, but a little bit of one restoration would help. Flossing, brushing, and stop the kids from having candies, because this kid was given by her father to spoil her because she's adorable. I cannot give you the name. I love her. I could adopt her as a daughter. We got a very close relationship. I'm very lucky with kids. However, I'm not a pediatric dentist. The next X-ray is this one. The dentist wanted to extract the tooth. I said no. And then the next time when I saw her, well, this is another caries now on the right side. So this kid is full of caries. And when you take a look at this one and you say, I cannot believe these teeth are coming here, the permanent, look how the permanent teeth are gonna be pushing this tooth. But it's not until 11 years, and she's only 4, 3 going to 4. What are we gonna do? It was literally, I tell you, for first time in my life, impossible. I didn't want to tie it by the arms. I didn't want to put the mouth to close her screaming. And United States is very protective with the kids. And I always push the patients, get inside your kids' treatment, whether it's with sedation, which in the United States is very straightforward. They put nitros, get inside, because you can monitor with your dentist. I hope they don't get offended, the pediatric doctors, but they put the kid to sleep. Just use nitros. It's a gas, but they have to be used correctly. I have a license in sedation, not for kids, but it's the same. You put oxygen first, then you put the nitros, unless they need a little bit of bigger sedation. But you can give Benadryl too. A good dose of Benadryl for kids will help you to relax the kids. So this kid for me, I dedicated 1.5 days. It was very difficult. But then there was worse, that because of the pandemic and time went by, the kid in a couple of months was worse. They did these 2 crowns already in this area when you see this. And it's a crime to me because then they did this treatment and then it got worse and ended up with root canals and they wanted to extract this tooth. I did a root canal to save it. And when I was in the middle, the kid was really impossible. So I decided to send it to a pediatric dentist. I love the parents. The parents are wonderful. I give them a big amount of knowledge. What do we do in these cases? Well, we continue what I said in past episodes. Canberra is a program what it's called Caries Assessment Management for risk assessment, and you can find it now. Apparently, you can Google it and get the forms of Canberra where you can get for my kid from 0 to 5. How are you gonna assess the risk? How many caries or how risk is your kid in caries disease? So you won't believe what I'm gonna tell you, but since pregnancy, my mentor was taking fluoride for when she was pregnant, and then after that, now they recommend that. UCLA has an amazing program. I'm sure USC also have a program where they do caries assessment with the mothers since the pregnancy, and they actually educate them a lot, and also they give them all the therapy plan for the house. What that means? Well, the first time you take your kid, here is the answer, is 6 months of age. At 6 months of age, and I'm gonna show you in my typodon for kids, you will see the kids have a couple of their temporary teeth, and the temporary teeth are extremely little, and I have a big model for the kids, and the temporary kids have, well, you can see here, very tiny teeth, right? And they only have 2 molars. They have this type of this is a permanent premolar, this is a mixed dentition. I have another little one that I was laughing with my producer because it's missing some teeth. In that little one, probably we have less of the permanent because this is a mixed dentition where you have an older kid, and this kid, in this kid you can see now it has one of the kid's teeth and then the permanent, right? Now, what happened here, when they are, imagine, 0 to 5, they are with the beginning of the teeth. So I'll tell you quickly the steps that you're gonna see. You have to take it to the doctor when they are 6 months. The first step they're gonna do, caries assessment. They're gonna see how risky is your kid, and you have to let the dentist give you the assessment or look at the Canberra page printed. It's in English and I have it in Spanish. And I don't know, there must be a lot of languages. Once they check that, the dentist can check if it's gonna do a prophy, it's gonna do a cleaning, and it's gonna do it's gonna apply fluoride. Also, it's gonna check how many caries the kid has, how many white spots, how much decalcification, and if your dentist is gonna tell you, Mom, you have to take care of your mouth this way, another way. Because the first type of contamination or contagious, believe it or not, is if the parents kiss in the mouth the kid, which you'll see like, ugh. When they're babies, they do that a lot. And I go crazy about it because they transfer the bacteria to the kids. And then, guess what happened? Now the kid is gonna have the bacteria that he didn't have to begin with, and now he's gonna have bacteria that's gonna produce decay, or they are giving from the same spoon, or the bottle of they were taking milk, they put it in their mouth to teach the kid how to take it. How are they doing taking the breast milk, which is another factor. So the pediatric dentist is the right one that you're gonna see and say, you know, I saw Dr. Fanny Yakaman giving advice, and my kid is 5 months old. If they see that you have a higher risk, they're gonna give you even a varnisher of fluoride. Isn't that amazing? What we have? You're gonna save money. Remember that in this program, in this show, every episode is saving you money by preventive measures in dentistry. This is Dr. Fanny Yakaman. If you have comments, write in our channel, subscribe to the channel, write your comments, give us a like, follow us on Instagram and TikTok. Thank you.